The core buildup, whether it's with a pin and or a post, is oftentimes a very crucial part of the whole crown and bridge procedure. The whole purpose of needing a buildup is going to depend on the condition of the teeth or tooth that's going to be prepared for the prosthesis. So if the tooth or the teeth that we're going to be working on has pretty extensive decay, and as the dentist is removing that decay, a lot of the tooth structure is lost, if we're going to be doing a crown or a bridge on that tooth or with that tooth, then it's going to need to be built up. Same thing if the crown or the tooth has been broken off. Maybe one or two of the cusps are broken or are pretty badly damaged, that when the dentist starts to prepare the tooth, there's really not a lot of structure there to be able to accommodate something to fit over the top of it. Also, endodontically treated teeth, oftentimes a tooth that has been treated with a root canal becomes very brittle, because then you have now removed that blood and nerve supply that was in the tooth before. So there's nothing going back into the tooth, so it tends to become a little bit brittle. So the need for putting a crown on top of it is going to be very, very important in order to save the tooth. But again, oftentimes, because it's not going to be as supportive because it's been endodontically treated, the need for a post might have to be taken into consideration and done. So the whole purpose of a buildup is to provide support to, again, the crown that's going to be put on top of it, and also to provide retention. So if not a lot of tooth structure was present and you try to put something over the top of it, oftentimes it's not going to last very long because it doesn't have a lot of support or retention to it. What helps to keep a lot of the things that we do in dentistry in place is going to be that retention that's there. Retention when it comes to fillings is done in the way that the dentist prepares the teeth. They either put undercuts in the tooth or create indentations within the tooth as they're preparing it to allow for the material to adhere to it much better. Well, the same thing has to be present in the case for a crown and or a bridge. It has to have not only support, but also that retention to help hold it in place. So core buildups can happen in a number of ways. It can be done either with composite, as you can see this tooth right here, and a good portion of this tooth has been built up in composite, or it can also be done in amalgam, which these teeth here you can see have been built up with amalgam. So those are two types or two ways that a buildup can take place. That is because there was still enough tooth structure there to be able to build it up just using either amalgam or composite. The need for a post or a pin, again, is going to depend on how extensive that tooth structure or loss of the tooth structure is going to be. Pins are placed, as you can see in this tooth here, these areas right here that are opaque are your pins, and they're strategically placed within the tooth that, again, when the buildup material is put in, whether it's composite or amalgam, that material adheres to that material and provides the strength and stability that it's going to need. Posts are only done in endodontically treated teeth. So if the tooth has had a prior root canal, then a post can be done, because what they do, rather than sticking a pin into the dentin portion of the tooth structure, the post is actually going down into the canal. If it was a vital tooth, there is no way we could stick something down into the canal because we would kill that nerve. So it has to be done on a previously endodontically treated tooth in order to do a post. But again, as you can see, the post is going to then provide that stability and that retention for that material to adhere to it, and then to provide the strength that it's going to need to accommodate something to fit over the top of it. These pictures here are kind of showing you on a posterior tooth and an anterior tooth how much tooth structure is actually removed and how much tooth structure is going to be needed in order to retain a crown or a bridge onto that prepared tooth. So if a lot of this tooth structure was already missing, they sort of have to build it up to allow for enough of the crown material to get placed over the top of it. To remember, we don't want it when it's placed on the teeth, when the crown is put on the teeth, that it's going to be or look abnormal because it's going to look too bulky. So the dentist has to know how much tooth structure to be able to take away, and it's going to depend on the material that the crown is going to be made of, on how much tooth structure needs to be removed and how much tooth structure there has to be in the first place in order to, one, provide that support needed, but also that retention to help it stay on. So this kind of gives you an idea of why buildups are going to be important when it comes to a tooth that maybe had extensive damage to it, whether it's decay, it broke, was previously treated with a root canal. Again, the whole purpose of it is to restore the teeth back to its normal function, to allow the patient to chew properly, also for it to look good, but also that it's going to be supportive and it's also going to provide that retention needed.